Common breastfeeding challenges and how to fix them. Breastfeeding isn't always easy. Many mothers expect it to flow smoothly, only to find themselves facing pain, frustration, or doubt. Let's look at the 5 most common breastfeeding problems, their causes, and what you can do to overcome them. Breastfeeding challenges and solutions. 1. Poor milk supply. A low milk supply is one of the most frequent concerns for new mothers. It happens due to medical conditions, hormonal imbalances, or simply not nursing often enough. Treatment to increase supply. Allow your baby to empty both breasts completely during each feed. If your baby loses interest early, pump the remaining milk and store it. Prevention. Stay hydrated, eat well, and get adequate sleep. Breastfeed on demand. Avoid formula in the first 6 months, and position your baby correctly for an effective latch. Hope this content is helpful for you till now. Subscribe and hit the bell icon for more such breastfeeding-related videos. Please continue watching. 2. Breast engorgement. Breast engorgement happens when milk production increases suddenly after birth. The breasts become swollen, heavy, and tender, which can make nursing uncomfortable for both mother and child. Treatment to relieve discomfort. Use warm compresses before feeding and cold compresses afterwards. Nurse your baby often, and if there is extra milk, pump or hand express it to ease pressure. Prevention. Nurse frequently and massage the breasts to keep milk flowing. Avoid early introduction of bottles or pacifiers so your baby stays interested in breastfeeding. 3. Incorrect latch. A poor latch occurs when the baby cannot take enough of the areola into their mouth. This causes nipple pain for the mother and reduces milk intake for the baby. Treatment. Position your baby so their mouth is just below the areola. Use pillows for support. Press the nipple with 2 fingers and guide your baby upward to achieve a deeper latch. Prevention. Work with a lactation consultant if needed, and always aim for a full mouthful of breast rather than just the nipple. 4. Nipple soreness. Nipple soreness is a common outcome of breastfeeding, often linked to shallow latching. It may lead to cracks, bleeding, and significant discomfort if not addressed early. Treatment to treat soreness. Avoid harsh soaps and instead use lanolin-based ointments. Letting breast milk dry naturally on the nipples also soothes irritation, as it contains anti-inflammatory properties. Prevention. Ensure a correct latch, alternating between both breasts, and wearing loose clothing that reduces friction on sensitive skin. 5. Yeast infection, thrush. Thrush is a yeast infection that can affect both mother and baby. It causes itching, redness, and pain during nursing. Babies may show white patches in the mouth. Treatment. Do not stop breastfeeding. Instead, consult your doctor for antifungal medication. Avoid over-the-counter drugs, as some may pass into breast milk and harm your baby. Prevention. Wash yourself and your baby daily, using fresh towels, and sterilize bottles, toys, and pacifiers in boiling water for at least 15 minutes each day. Breastfeeding is a learning process for both mother and baby. Patience and persistence make the journey smoother,